Point of care testing. So point of care testing, or POCT, so according to the College of American Pathologists, or CAP, point of care testing is defined as those analytical patient testing activities provided within the institution but performed outside the physical facilities of the clinical laboratory. So testing characteristics, this testing is conducted close to the patient rather than the centralized clinical laboratory. So lots of times in the hospital it's bedside. These can be performed by non-laboratory personnel, such as nurses or physicians or other healthcare staff. And despite decentralization, laboratory professionals provide oversight to ensure quality and accuracy of the results. So even though it's still not being performed in the lab, lots of times the lab will still have an oversight of this to ensure it's being done appropriately. Components of the point of care programs, we have quality and management, so administration and structure. Effective management and organizational structure are essential, of course. There are usually going to be clear roles, responsibilities, and communication channels. If you think about it, it's not within the lab, right? So we have to have that communication to be able to get what we need out there to everybody. We're also going to have proper resource allocation and workflow design to support that testing process. Knowledge and skill base, so personnel performing tests still have to have the appropriate education, training, and competencies performed. They will have ongoing education and skill assessments to maintain the high quality performance of the testing. Lab staff and non-lab personnel involved in testing need to make sure that they understand the testing principles and limitations. As far as regulatory compliance and high quality patient results, so we still have to follow compliance with the regulatory standards with CLIA and CAP and the FDA. This helps to ensure patient safety, accuracy, and reliability of test results. Quality control, proficiency testing, and documentation are still essential components that are part of a point of care program. And oversight by qualified laboratory professionals is also crucial to maintain those standards. So CLIA, this testing falls under the scope of CLIA. So laboratory testing in the United States, as mentioned earlier, falls under CLIA. Every single test that is performed on a human falls under the CLIA umbrella, if you will. CLIA establishes the quality control regulations and personnel standards to ensure the accuracy and the reliability of patient testing. So there are different testing levels within CLIA. So CLIA has categorized these into 3 complexity levels, and this is based on the risk to the patient and the technical skill required. So wave test, which is usually where the point of care tests fall, not always, but usually. The wave tests represent the lowest level of regulation. It basically makes up a simple test with low risk of erroneous errors. Some examples include the glucose test and urine dipsticks. It has minimal requirements for personnel qualifications and quality assurance. And then we move up to moderate complexity testing. This requires an adherence to stricter standards than the waived. Personnel must meet specific qualifications, and they require proficiency testing, quality assurance, quality control, and regular inspections for these testing. And then we move up to the highest, which is the high complexity test. This involves more technical skill and a higher risk. It must fulfill all requirements for personnel qualifications, proficiency testing, inspections, quality control, quality assurance, and patient test management. So examples for these could include molecular diagnostics, cytogenetics. A lot of hospital labs will have a mix between moderate and high complexity testing, as well as wave testing as well. So point of care is also under CLIA, can also be under CAP or COLA or Joint Commission as well. So we've got, let's see, these organizations help to ensure compliance with quality standards and regulatory requirements for the point of care test. It can also be under a PPM, or a provider performed microscopy. This refers to it's like a little subcategory of the moderate complexity test. This includes microscope procedures or microscopy procedures that are performed by healthcare providers at the site of the patient. So a lot of times, if I think about it, in women's health centers, they'll do a PPM procedure, and they're doing like a wet mount, on a microscope, and they're doing it in the room with the patient there, or even, back at their desk. That would be considered a PPM. It's not laboratory staff doing it. It's usually, a clinician, like a nurse practitioner, a doctor, something like that. Quality control is usually not available for PPM just because of their nature, but a lot of times we still want to try to develop something if we can to ensure the accuracy. Certifications, so the testing site, they have to obtain a PPM certificate to legally perform and bill for these tests. Personnel requirements, as mentioned earlier, usually it's a licensed physician, dentist, or mid-level practitioner like a nurse practitioner, physician's assistant, to perform these types of tests. For point of care support staff, you'll have a director usually who's kind of the overarching person on this, who's kind of going to be responsible for everything of it. And then you have your point of care coordinator. That person is usually the one who's doing the work, right? Who's kind of coordinating it all, making sure the quality control is getting done, that the staff's getting trained. And then you're going to have designated contacts in non-lab departments as well. So you're going to have your like a nursing lead or somebody take over that role on certain departments or certain floors. So you can go to that one person if needed for anything, for training, documentation, things like that. Standardization. So advantages for having this consistent use of point of care testing across healthcare is you have uniform application of point of care. It helps to ensure reliable and standardized testing procedures. It also promotes confidence in test results regardless of the care setting. So if they're in the clinic, if they're in a hospital, that type of situation. You can compare results across locations a little easier as well. It helps to enable accurate comparison of patient data from different healthcare sites. It can also enhance clinical decision making and continuity of patient care, and can help facilitate coordinated treatment plans as well for the patient. Cost savings. Sometimes it can reduce the need for repeat or confirmatory testing, can lower expense related to sample transport and laboratory delays, and can optimize resource utilization. So I say sometimes it saves costs because point of care testing is generally more expensive per test than if we were to just run it in the lab. But when you factor in transport and other things like that, that's where the cost savings can come in. It can also save work and time, so we have a quicker turnaround time, and it can accelerate diagnosis and treatment for our patient. It can reduce workload on central laboratories, and it can help to actually empower frontline healthcare workers to deliver timely care. It's nice that you can have a result in a few minutes for your patient instead of waiting a couple of days. It can also facilitate regulatory compliance, so we can standardize point of care testing procedures to simplify adherence to the regulatory and accreditation requirements. It can streamline quality control and documentation efforts, and as mentioned before, it can enhance patient safety and test accuracy. Oversight structure, so we can facilitate timely and accurate performance. So that would ensure that point of care testing is performed efficiently and correctly at the point of care, so wherever the patient is, reduces errors and improves the reliability of test results, and supports rapid clinical decision making. Facilitate compliance with regulatory agencies, can help healthcare facilities meet standards that are set by CLIA, CAP, COLA, Joint Commission, things like that. Can help ensure proper documentation, quality control, and proficiency testing, and maintain certification and accreditation status. Coordinate and facilitate standardization across facilities, would promote uniform testing methods, procedures, and policies across multiple sites. Having that coordination can also enhance comparability of results and overall quality of patient care. So if they go to one clinic one day and then a month later they go to a different clinic, they're probably using the same point of care testing, so the comparability would be there. You can also help to streamline purchasing, training, and quality assurance processes as well. We can also coordinate and facilitate communication, so the coordinator can act as a liaison between laboratory professionals, healthcare providers, and administration. It can help to ensure clear, timely sharing of test results and updates on procedures, and can also help resolve issues and support continuous improvement. The coordinator can also facilitate education of the point of care personnel, so they can provide ongoing training and competency assessments, update staffs if there's any new devices, new protocols, or any regulatory changes. And they can also empower non-laboratory personnel to perform point of care testing safely and effectively. Because believe it or not everyone is trained in the lab and knows how important it is to follow the procedure and doing quality control and calibrations when they are needed. All right, so let's say you're working in a lab and a doctor comes to you with a point of care test request to bring into the lab. So the first thing you're going to want is you're going to want to document that request, why they want it, if there's any clinical needs for it, that type of situation. And then you're going to move on to kind of sort of the fun part. You're going to select the devices and methods. You're going to be able to evaluate available point of care testing devices and methodologies that are out there. You're going to want to consider factors such as accuracy, is it easy to use, cost, and compatibility with what you currently have, including your LIS. You want to validate the methodology after you've picked one, so you're going to perform validation studies to ensure reliable and accuracy. You're going to compare point of care test results with standard laboratory methods, and then you want to assess precision, sensitivity, specificity, and if it's user-friendly. You're going to want to try to negotiate that contract if you can, so establish agreements with the device manufacturers or vendors, define terms for purchase, maintenance, support, and training. Then you're going to implement the test procedure, and when you do that, you want to make sure that you develop and standardize testing protocols. You're going to integrate point-of-care testing into clinical workflows, and then you want to also ensure proper documentation and record keeping. As far as the training checklist goes, you want to create a comprehensive checklist for training all point-of-care testing personnel. You want to cover device operation, quality control, troubleshooting, and safety. You also want to verify competency before they start testing on patients, so make sure they are done with their training before they are set loose. Once that is all done, you'll have proficiency testing, hopefully. You want to enroll in proficiency testing. That helps to just monitor the accuracy and that the test is still doing what it's supposed to do. You want to conduct regular performance assessments and address deficiencies promptly to help maintain the quality of the test and the results. Point of care testing, so the applications, this is the highest volume test, is glucose testing. It is the most frequently performed point of care test. It's widely used for monitoring diabetic patients, and it provides immediate results for clinical decision making. So other commonly used point of care tests are electrolytes and blood gases. It measures the key electrolytes like sodium, potassium, and it also does your blood gases as well, so pH, partial CO2, partial oxygen, things like that. This is critical for managing patients in emergency and intensive care settings. We also have coagulation testing, so they can use the ACT, which is an activated clotting time. This is used to monitor heparin therapy, usually during surgeries or procedures that require anticoagulation. So as you can assume, the rapid assessment of the coagulation status at the bedside is way more convenient and safer for our patient than trying to, draw a tube, send it to the lab, get the results back in a half an hour type situation. They can get it in a couple of minutes right then and there. Hematology testing. So previously the spun hematocrit was done bedside, but now we have a bedside hemoglobin testing that is coming, or that is out. It provides a quick, snapshot of the patient's anemia status or blood loss.